Have you ever taken a medication every day without really knowing what it's doing in your body? If you, or someone in your family, takes Losartan, this is the video you didn't know you needed. Today, we're going to walk through 10 surprising truths about Losartan, some of which even many doctors don't explain clearly in a standard consultation. So, if you're ready to learn more about what this simple blood pressure pill actually does, stick around. You'll understand why it's used, how it works, and when it might be helping or hurting you in ways you never imagined. Before we dive in, tap like, subscribe, and stay until the end so you can make more informed decisions about your health. Let's start with the most important question of all. What is Losartan really used for? And is it just for high blood pressure? 3 core benefits. It's not just a blood pressure pill. Most people think Losartan is only for high blood pressure, and yes, that's its most popular use. But what many patients don't know is that Losartan actually has 3 primary roles in modern medicine, and 2 of them are completely independent of whether or not you have hypertension. Let's break them down one by one. 1. Controlling blood pressure. Hypertension. This is the primary reason doctors prescribe Losartan. When your blood pressure is too high, it puts enormous stress on your heart, arteries, kidneys, and even your brain. Over time, that pressure leads to heart failure, stroke, kidney damage, vision problems, vascular dementia. Losartan works by blocking the effects of angiotensin II, a hormone that constricts blood vessels. When that hormone is blocked, your vessels relax and your pressure lowers. It's not a magical drop overnight, but over time, this pressure control drastically reduces your risk of serious complications. 2. Helping with heart failure. Here's what might surprise you. Even if your blood pressure is normal, your doctor may still prescribe Losartan if you have heart failure. Why? Because in heart failure, the heart struggles to pump blood efficiently. Losartan helps by reducing the resistance that the heart has to push against. This improves cardiac output and reduces strain on the heart. Losartan is especially helpful in early to moderate stages of heart failure and is often paired with other medications like beta blockers or diuretics to maximize protection. 3. Protecting kidney function. One of the most powerful and lesser-known benefits of Losartan is its ability to protect the kidneys, especially in people with diabetes or early signs of chronic kidney disease, CKD. It does this by reducing protein loss in the urine, proteinuria, a major marker of kidney damage. In diabetic patients, this protection can literally delay or prevent the onset of kidney failure. Several major clinical studies have confirmed that Losartan lowers proteinuria, slows progression of nephropathy, reduces the risk of needing dialysis later in life. So if your doctor has prescribed Losartan and you're not sure why, it may have nothing to do with your blood pressure. It may be about your heart or kidneys. And now, you know. How fast does Losartan work and why patience pays off? If you've ever taken a pill and expected instant results, you're not alone. Many people think blood pressure medications like Losartan work within minutes, like a painkiller or an anxiety med. But Losartan doesn't work that way, and knowing how it behaves in your body can help you avoid mistakes and false expectations. How long until it starts working? After you swallow a Losartan tablet, it's absorbed into your bloodstream within about 1 hour. You might start to see a small drop in your blood pressure after 2 to 3 hours. However, this is just the beginning. The full effect builds gradually over several days. Most doctors agree that Losartan reaches its peak blood pressure lowering effect after about 3 to 6 weeks of consistent daily use. That's right, weeks, not hours. So if you start Losartan today and check your pressure tomorrow, don't expect dramatic changes yet. The medication is laying the foundation, not finishing the job. Why some people get discouraged. Some patients stop taking Losartan after a few days because they think it isn't working. But here's the truth. Your body is adjusting to the new chemical balance. It takes time for your arteries to relax, your kidneys to recalibrate, and your heart to experience less stress. Stopping too soon interrupts that entire process. Even worse, missing doses in the early weeks can confuse your body and reduce the drug's long-term effectiveness. Think long-term, not emergency. Losartan is not designed for emergency blood pressure control. If you go to the ER with a hypertensive crisis, they won't give you Losartan. Instead, they'll use fast-acting medications like captopril, clonidine, or intravenous options. Losartan is for long-term maintenance, not rescue. Its value lies in building a steady, low-pressure environment in your body that protects your organs every day, not just today. Pro tip: track your progress weekly, not daily. Don't obsess over daily numbers. Instead, take your pressure at the same time each day, preferably in the morning. Write it down in a notebook or app. Look for trends over 7 to 10 days, not hour-to-hour shifts. You'll be amazed at how much clearer the picture becomes over time. Should you take Losartan once or twice a day? What doctors actually do? You might have been told to take Losartan once a day, or maybe you were told to split the dose into morning and evening. So, which one is right? The truth is, there's a gap between what research says and what doctors often do in real life. Let's unpack it. What studies say? Clinical guidelines state that Losartan can be taken once a day. Its blood pressure-lowering effects last for about 24 hours, which is why most prescriptions are written for a single daily dose. That's convenient and easy to remember, especially for patients who struggle with complex medication schedules. But here's what doctors see in real life. In practice, many cardiologists and nephrologists have observed that Losartan's effect doesn't always last a full 24 hours, especially in patients with more severe hypertension or those taking lower doses. Instead, its effective window seems to last around 18 to 20 hours in some individuals. That means your pressure may be well controlled during the day, but start creeping up again in the evening or early morning. This is called morning surge hypertension, and it's a known risk factor for strokes and heart attacks. The case for splitting the dose. If you're on a higher dose, like 100 milligrams per day, some doctors will recommend splitting it into 50 milligrams in the morning and 50 milligrams at night. This helps maintain stable blood levels and prevents those dangerous early morning pressure spikes. It may also reduce side effects like dizziness or fatigue by avoiding one large hit of the medication all at once. So, what should you do? Follow your doctor's instructions. They know your specific case. But if you're only taking it once a day and still have pressure spikes at night or early morning, talk to your doctor about the possibility of splitting the dose. Don't make changes on your own, even if it seems logical. Quick tips. Take Losartan at the same times each day, whether once or twice. Use alarms, pill boxes, or habit triggers, like brushing your teeth. If you miss a dose, don't double up. Just resume as scheduled the next day. Losartan and kidney function, how it protects and when it can backfire. You've probably heard that Losartan protects your kidneys. But is that always true? And how does it really work? The answer depends on your starting kidney function, and knowing where you stand can make all the difference between healing and harm. Why high blood pressure destroys kidneys. Your kidneys filter your blood 24/7 through millions of tiny blood vessels. When your blood pressure is high, that pressure damages the fragile structures in the kidneys. Over time, it leads to protein leaking into the urine, proteinuria, loss of filtration function, high creatinine, increased risk of kidney failure and dialysis. So managing blood pressure isn't just about your heart. It's the #1 way to protect your kidneys. How Losartan helps. Losartan not only lowers blood pressure but also specifically reduces protein leakage in the urine, which is one of the earliest signs of kidney damage. It does this by relaxing the blood vessels inside the kidneys, reducing pressure and allowing for smoother filtration. This effect is especially helpful in people with diabetes, chronic kidney disease, CKD, hypertension with proteinuria, Major studies, like the Renal trial, showed that Losartan reduced proteinuria by up to 35%, slowed the progression of kidney disease, lowered the chance of going on dialysis. That's huge, especially if you're trying to avoid future renal failure. But there's a catch: when your kidneys are already weak. If your kidneys are already severely impaired, Losartan must be used with caution. In people with advanced kidney disease, especially if creatinine clearance is below 30, Losartan can initially reduce filtration further. This doesn't always mean it's dangerous, but it does mean you need close monitoring. In some cases, kidney function dips slightly when starting the drug, but improves over time. In others, the decline continues, and the drug must be stopped. That's why doctors will check your creatinine eGFR, estimated glomerular filtration rate potassium levels, before and after starting Losartan. Important: don't panic, don't skip tests. If your doctor says you need Losartan to protect your kidneys, trust that they've weighed the risks. But also, get your labs done on time. Report any swelling, fatigue, or reduced urination. Never self-adjust or stop the medication. Suddenly, Losartan can be a powerful renal protector, but only when used with care and oversight. Losartan and uric acid, a unique bonus. You didn't expect. When you think of blood pressure medication, you probably don't think about joint pain or gout. But surprisingly, Losartan has a special bonus effect that can help people with elevated uric acid levels, something that makes it stand out from most drugs in its class. What is uric acid, and why should you care? Uric acid is a waste product formed when your body breaks down purines, which are found in red meat, seafood, alcohol, and certain vegetables. Normally, your kidneys filter uric acid and eliminate it through urine. But when your body produces too much, or your kidneys can't clear enough, it builds up in your blood. High uric acid levels, hyperuricemia, can lead to painful gout attacks, especially in the feet, kidney stones, chronic inflammation in the joints, even higher risk of cardiovascular disease. How Losartan helps and why it's unique. Losartan is the only ARB, angiotensin receptor blocker, with a mild uricosuric effect, meaning it actually increases the amount of uric acid your kidneys excrete. That makes it uniquely helpful in people who have high blood pressure and also deal with gout or high uric acid levels. Most blood pressure meds do nothing for uric acid, or worse, make it worse. For example, diuretics, like hydrochlorothiazide, can increase uric acid. ACE inhibitors and other ARBs are neutral, but Losartan lowers it. How much does it lower uric acid? In clinical studies, Losartan has been shown to reduce serum uric acid levels by about 10% to 20% on average. That might not sound like much, but for someone with borderline levels, it can be enough to prevent a gout flare-up, lower the risk of new kidney stones, avoid the need for separate medications like allopurinol. Important: not a cure for gout. Don't misunderstand. Losartan is not a gout treatment. If your uric acid is very high or you've had multiple flares, you may still need targeted therapy. But if you're managing hypertension and elevated uric acid together, Losartan can be a smart 2-in-1 solution that simplifies your regimen. Summary: Losartan helps lower uric acid, a rare trait among blood pressure medications. It may reduce gout risk and protect kidneys, but it's not a replacement for real gout medications when needed. Losartan side effects: what's normal, what's rare, and when to worry. Every medication has side effects, but not all side effects are worth panicking over, and some are just your body adjusting. With Losartan, most people experience very few problems, but it's still important to know what to expect, and when something might require medical attention. Common and mild side effects. These are the most reported effects during the first few weeks of use. They're usually temporary and often go away as your body adapts. Dizziness or lightheadedness, especially when standing up quickly. Fatigue or weakness in the first days of treatment. Mild headache or heavy head sensation, back pain or leg cramps due to shifts in fluid and electrolytes. To reduce dizziness, try drinking water regularly, standing up slowly, taking your dose at night if your doctor allows. Less common, but worth monitoring. These symptoms aren't dangerous by themselves, but you should tell your doctor if they persist. Persistent dry cough. While this is more common with ACE inhibitors like captopril or enalapril, a small number of people also report it with Losartan. Mild swelling in the ankles or feet can indicate fluid retention or mild circulation issues. Muscle cramps or heart palpitations may be signs of an electrolyte imbalance, especially potassium. Increased uric acid levels. Although rare with Losartan, which usually lowers uric acid, this can still happen in some individuals. Rare but serious effects. Seek immediate help. If you experience any of the following, stop the medication and contact emergency care. Swelling of the face, lips, tongue, or throat, possible allergic reaction. Difficulty breathing, severe dizziness or fainting, signs of high potassium, irregular heartbeat, muscle weakness, tingling. Also watch for signs of kidney trouble such as dark urine, persistent nausea or vomiting, noticeable drop in urine output. These may require lab tests to check your creatinine and potassium levels. Can you stop taking Losartan? One day? The truth about long-term use. One of the biggest questions patients ask, often quietly, is this: are you dependent on Losartan? Losartan does not cause physical dependence, but if you stop suddenly, especially after long-term use, your blood pressure may rebound. That's not addiction. That's your body losing the protection the drug was providing. Most side effects are mild and short-term. Serious reactions are rare, but need attention. Always report unusual symptoms, especially when starting or changing dosage. Will I have to take Losartan for the rest of my life? It's a fair question. No one likes the idea of being on medication forever. And the honest answer is, it depends on why you're taking it in the first place. Why you were prescribed Losartan in the first place matters. If you were prescribed Losartan just to lower blood pressure during a short-term situation, like stress, surgery recovery, or sudden weight gain, then yes, you may eventually be able to stop. But if you're taking it due to long-standing essential hypertension, chronic kidney disease, diabetes-related nephropathy, or a history of stroke or heart failure, then stopping it might not be an option unless you dramatically change your health from the inside out. Can lifestyle replace medication? Sometimes yes. If you lose weight, even 5 to 10%, lower your salt intake, eat a whole food, plant-rich diet, Mediterranean, exercise 30 minutes a day, quit smoking, reduce alcohol, sleep better, manage stress, your blood pressure may lower enough to taper off Losartan with your doctor's guidance. But here's the truth. Most people don't stick to lifestyle changes long enough to come off meds. Not because they don't care, but because life gets in the way. That's why meds exist. Warning: don't stop cold turkey. Losartan isn't addictive, but your body adapts to it. Stopping suddenly can cause blood pressure to spike, risk of stroke or heart attack to rise, kidney stress to return. If you're considering stopping, your doctor may suggest cutting your dose in half, monitoring your pressure daily, rechecking labs after 2 to 4 weeks, possibly switching to another class of medication. Never stop on your own, even if you feel fine. The real goal isn't no pills, it's no pressure. Remember, the goal isn't to be med-free. The goal is to be disease-free, complication-free, and hospital-free. If that means staying on Losartan to protect your kidneys and heart, it's worth it. And if one day your health improves enough to wean off safely, great. But don't force it. Final verdict: should you stay on Losartan? What you now know that most patients don't. You've just learned more about Losartan than most people will ever hear from a single doctor's visit. You now know what it does, how it works, what it protects, and what it doesn't. So now comes the big question. Should you keep taking it? Let's break it down. When Losartan makes sense. Losartan is one of the most widely used blood pressure medications in the world, and for good reason. It's effective, it's generally well tolerated, and it offers unique benefits beyond pressure control, including kidney protection in diabetics, reduced proteinuria, a rare ability to lower uric acid, and support in heart failure. If you've had a stroke, heart issue, or kidney diagnosis, it's probably helping more than you realize. When you should reevaluate. However, Losartan might not be for everyone. It's time to ask questions if your blood pressure is always normal without it. You're experiencing side effects like dizziness or fatigue. You've made huge lifestyle changes and haven't rechecked with your doctor. Your kidney numbers are getting worse despite treatment. Don't panic, but don't stay on a medication just out of habit either. Medicine should always serve a purpose. Periodic review is key. Set a reminder every 6 to 12 months to ask, do I still need this dose? Can we try a lower one? Have my lab numbers improved? Are there better options now? Even if nothing changes, this keeps you in control, not just passively following prescriptions. What you should ask your doctor. Before your next visit, prepare questions like, is my blood pressure in target range? How are my kidneys doing? Would I qualify for a different medication with fewer side effects? Can we try a taper? Doctors appreciate informed, engaged patients, and these conversations can save your life. Final word, stay informed, stay empowered. Losartan isn't a magic pill, but it is a powerful tool. When used correctly, it can help you prevent stroke, protect your kidneys, manage heart failure, avoid complications from silent hypertension, but it's just that, a tool. The real work comes from you, your choices, your questions, your follow-ups. If you've made it to the end of this series, congratulations. You've taken a major step toward owning your health. You made it to the end. If this video helped you better understand Losartan, please like this video, subscribe to Health Integration, comment below with your experience using Losartan, share this with someone who takes blood pressure medication. It could save them confusion or risk. Stay informed. Stay healthy. See you in the next video. Bye-bye.